Today we will show you how to take blood pressure. The two pieces of equipment needed to take blood pressure are the stethoscope and the sphygmomanometer. On the stethoscope, this is the diaphragm, and these are the ear tips. When using this, you want to have the ear tips facing forward, like this. This is an aneroid sphygmometer. To get the correct size for the patient, you have to use this size chart. The parts of it would be the valve, the gauge, the bulb, and this whole thing is the bladder, and this is the rubber tubing. You take blood pressure at the brachial artery. To take it, for resting blood pressure, you need the person sitting casually for at least 5 minutes.
It's important to take blood pressure because if it's too high or too low, it can indicate that there could be long-term health problems. And when taking blood pressure, you're going to want to start about 20 millimeters of mercury above your suspected systolic blood pressure to make sure that you get the full and correct blood pressure. You want to turn the valve to the right to pump and to the left to release pressure. When releasing pressure, you're going to want to do this at about 2 millimeters of mercury per second. You're listening for the sounds of blood squirting against the brachial artery walls. This is known as Korsakoff sounds, but in normal people terms, it's known as tapping.
When putting on the blood pressure cuff, you want to mark up the limb and the artery mark with her brachial artery. You want to put it on snugly, but not too snug so that it stays up but does not cut off any circulation so that you can pump correctly. Have the gauge facing you and be ready to pump your bulb. Now I will demonstrate how to take blood pressure. When taking blood pressure, you are listening to the first sound of blood squirting through the arterial wall in the brachial artery, and that would be systolic blood pressure when you first hear it. You'll continue to hear it after until diastolic blood pressure, which is the last time you hear that sound. First, you want to have your stethoscope ready. After having the patient have the cuff on them, you want to have it snug with the gauge facing you and accessible to the pump and the valve. When you put on your stethoscope, you want your ear tips pointing forward, and you want to put your diaphragm right on the brachial artery. You turn it to the right to pump, and you turn the valve to the left to release. When pumping, you want to go about 20 over suspected systolic blood pressure, and when releasing, you want to release at about 2 millimeters of mercury per second. Taylor's blood pressure was 120 over 80 millimeters of mercury. Blood pressure is represented by systolic over diastolic millimeters of mercury. The normal ranges would be 120 over 80. Pre-hypertensive is 130 to 139 over 85 to 89. Hypertensive stage 1 is 140 to 159 over 90 to 99. And hypertensive stage 2 is 160 to 179 over 100 to 109. Taylor's blood pressure was 120 over 80, so she fell perfectly in the normal range.